Good day, sir. I am your student nurse Marmar Cabigas from BSN 1C. Today, I am going to perform assessing the abdomen of my patient return demonstration. So, the assessment of the abdomen consists of inspection, palpation, percussion, and auscultation. So first, we need to perform hand hygiene and put on PPE if indicated, and identify the client's identity using the agency protocol. So, good afternoon, sir. I am Marmar Cabigas and I will be your nurse for today. May I know about your full name, sir? When is your birthday? Your age? So, is it okay that I am going to hold your hand to check for your wristband? Okay, thank you. Next is we have to close all the curtains around the bed and close the doors into our patient's room if possible. So, sir, all the curtains and all the doors are now closed to ensure your privacy. Explain the purpose of the abdominal examination and what you are going to do, then answer any questions. Okay, so the procedure that I will be doing, sir, is that I am going to check if there is any abnormalities that is present to your abdomen. I'll be touching some parts of your body and I'm going to expose some parts of your body also. And there's a movement that you should follow. Would that be okay with you? Okay, so but before that, do you have any clarifications or concerns? Okay, so I'm going to ask you questions, sir, and I promise that all the information that I've gathered from you will remain confidential, okay? So, do you feel pain into your stomach? Do you experience nausea or vomiting? Have you noticed change into your appetite? Okay, so how about constipation or diarrhea, sir? Okay, so what food did you ingest last 24 hours? Okay, so in a few minutes, sir, we will going to start, okay? Help the patient to undress if needed and provide the client gown. Assist the client to a supine position and expose the abdomen part. Use a bath blanket to cover any exposed area other than the one that is being assessed. Inspect for the abdomen skin color, contour, pulsations, the umbilical, and the other characteristics such as rashes, lesions, scars, and masses. So upon inspection of the abdomen of my patient, I'm watching like this. So I can see that your abdomen skin color is lighter than the rest of your body. No lesions, no stretch marks, but I can see a small marks right here, and your umbilicus is in midline. So, upon inspecting the abdomen of my patient, I am watching like this. So, I may not be able to visualize. I may not be able to differentiate all the movements. So, I have to watch it first from the lateral view to look for the contour. Okay. So, I can see that your abdomen is flat and symmetrical. Then after that, I am going to watch it from the foot of the bed. So, I am going to look from the foot of the bed to look for the symmetry, and the both sides should be the same, which they are. Auscultate all four quadrants of the abdomen for vowel sounds using the diaphragm of the stethoscope. Use a systematic method. Okay, so I want to listen to the vowel sounds, and we don't have to rush here because after every 5 to 10 seconds, we can hear a one vowel sound and we have to wait. Suppose we are staying there for more than 2 minutes, then we don't hear any vowel sounds, then we can classify it as a silent vowel. Okay? So I am going to start here at the right lower quadrant. Right upper quadrant. And we're going to the left upper quadrant. We're going down to the left lower quadrant. Then next is we have to auscultate the abdomen for vascular sounds. And we have to use the bell side of the stethoscope. Assess over the aorta, renal arteries, iliac, and femoral arteries. Usually, no sound is present. Loud breath over the aorta indicates aneurysm. Okay, so I am going to use the bell side of my stethoscope. And I'm going to start here at the aorta area. Right renal artery. Right iliac artery. Down to the left iliac artery, down to the femoral artery. Okay. Percast the abdomen for tones. So what I want to assess while doing the percussion is that I am going to check if there is any hepatomegaly or splenomegaly. I want also to check if there is any fluid present in the peritoneal area. I want also to check for the shifting of the dullness. And now, I want to check the level of the free fluid in the body. So first of all, I want to start over the bladder, and after that, I will be moving towards the right side. Now, I am going to ask my patient to move laterally. So if there is any free fluid in the body, the fluid is going to shift at the down part. And after that, I will be checking for the shifting of the dullness if there is any fluid present over there. Okay, so can you move laterally first, sir? Palpate the abdomen, all four quadrants lightly, and then palpate using a deep palpation technique. So I am going to touch this segment of the abdomen using my fingers. I am going to check if there is any lumps or any masses that is present to the abdomen of my patient. So I am going to watch the face of my patient. If there will be any tenderness, patient will feel pain. So by just watching the face of the patient, we can assess the condition. So first, I am going to palpate it lightly. Okay, do you feel pain? Tell me if you feel any pain, okay? And we're done. We can now proceed to the deep palpation. Okay. Do you feel pain? Okay. Tell me if you feel any pain, okay? If the patient complains of pain or discomfort in a particular area of the abdomen, we can palpate that area last. Next is we have to palpate the kidneys on each side of the abdomen. Palpate the liver at the right costal border and palpate the spleen at the left costal border. Okay, to palpate the liver, always start from the lower part, the right lower quadrant, and move up. So I want you to breathe in and breathe out for me, okay? Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Okay? So breathe in and breathe out for me, okay? Okay, breathe in and out. Okay, breathe in. Okay, breathe in and out. For the palpation of the kidney, single hand will not be enough, so we have to use our both hands. And this is called as the bimanual examination. Okay, breathe in and breathe out for me, sir. Okay, one more time. Okay, I'll go over the other side. Okay, one more time, please. Assess for rebound tenderness. Rebound tenderness is when there is a brief worsening pain after releasing pressure while palpating. Palpate deeply of the abdomen with your hand. After a moment, release pressure quickly. If it hurts more when you release, then the patient has a rebound tenderness. Next is we have to palpate and auscultate the femoral pulses on the groin. Okay, so I'm going to palpate. Okay, I'll go over the other side. the patient in replacing the gown, remove PPE if used, then perform hand hygiene. Continue with the assessment on the specific body systems as appropriate or indicated. Lastly, we can now initiate appropriate referral to other healthcare practitioners for further evaluation as indicated.